All right, well, hello. My name is Jennifer Wu. I'm the Vice Dean for Academic Affairs in the School of Medicine and the Deputy Chief Academic Officer for UNC Health. And it is my honor and privilege to be able to be up here to join this panel and to welcome you all and to say thank you so much for the donors, for all of your support. It's really made a huge difference in our medical school and School of Medicine. I'm excited to be joined by Catherine Poulos and Jasper Mark, and we're going to hear more about sort of their journeys and their experiences here at UNC in a moment. I'd also like to take this time to introduce Dr. Samantha Meltzer-Brody. She's our new Executive Dean in the School of Medicine. She's also the Asad Memandi Distinguished Professor and has been our Chair of Psychiatry, as well as the Director of the Center for Women's Mood Disorders. And so I'd like to take this opportunity to have Samantha tell us a little bit more about her new role and what inspired her to sort of be in this role.
Well, thank you. It is a great honor and privilege for me to join today. I have been at UNC, it will be 25 years this summer. I'm originally an Ohioan, but made my way here almost 29 years ago. And it is such an honor to succeed Dr. Christy Page as the Executive Dean. I have the privilege to lead the education and research mission at our school and to co-lead with others the clinical mission at the School of Medicine. My charge is to ensure our students have what they need to grow, to learn, to thrive, and then to be ready to leave our school and go out and do great things. And like all of you, it is so heartwarming to see our alum come back, and I hope you're enjoying interacting with our amazing students today, because we are so proud of what we do. I wanted to mention a few things about how proud we are about the School of Medicine and the incredible work that happens here. We just were ranked in U.S. News and World Report as a Tier 1 school in both primary care and research, a very small group that were ranked at the highest levels in both. And I think that reflects our mission. We serve the people of North Carolina. We serve rural areas of North Carolina, but we also excel in research on the global stage. And we also were ranked in a new report that came out, number 23 in the world in one of these world rankings, which sounds like has quite a ring. And so you all can feel very, very proud about that. You can throw that out there. So before we turn the spotlight on Catherine Poulos and Jasper Mark, I'd like to introduce Dr. Chris Ingersoll. Dr. Ingersoll, there he is, our Senior Associate Dean and Chair of the Department of Health Sciences. Our Health Sciences Department is incredible, and having Dr. Ingersoll join us has been such a great pleasure. It includes 8 highly regarded divisions, from physical assistant studies to clinical laboratory studies, and also received highest rankings within the top 10 in most of the divisions of his program. And so really it is incredible. And I'd like to call out that Jasper is part of that school. And so he is a PhD student in human movement sciences in the Division of Physical Therapy in the Health Sciences School. And then we have Catherine Poulos, who is a 4th-year medical student here in the School of Medicine. So Jasper, we'll start with you. Okay. How about you tell us what led to your path to being interested in human movement studies, science, and what brought you to UNC?
Absolutely. So ironically, I went here for undergrad. I started here in 2016, and I always wanted to go to medical school. I took the MCAT, studied really hard for it, and then the next week I joined a research lab, and I just got the research bug. I know I could have done research as a clinician, but I felt like the questions I needed to answer, they required having some formal training in terms of a PhD. So I got the research bug, and I realized it's kind of like solving a puzzle. There's all kinds of questions, all kinds of ways that we can kind of tease everything together. And I think that's really what hooked me. I joined this awesome lab, found my advisor, and I decided to kind of stay on with that. Although I think it's kind of unique. I cheered here at UNC. So as a cheerleader, I spent a lot of time on the sidelines. I was like on the football field, but no one really looked at me. But, unless they wanted a t-shirt. So I throw them there and hurt my arm. But I spent a lot of time on the sidelines. And now as a researcher, I'm trying to see, okay, I'm still behind the scenes, but, the goal is eventually to reach out to patients and to not just be on the sidelines and support physicians, but to lead to patient treatments and to improve patient outcomes. Yeah.
It's amazing.
Can you tell us a little bit, like, sort of how long your PhD program is, where you are in your training, what you see maybe in the future?
Absolutely. So I'm a third year. Geez, almost a fourth year. I wish. So I finished all my classes and I have about 1 year left. So I proposed my dissertation in a few months, actually the end of this month, and then I'll start the long process of writing a couple hundred pages of work. So no one will read it, but at least I will. So
That's going to be great.
yeah, I hope so. Thank you. But I guess I'm almost a fourth year. I know you're just starting your fourth year.
I am.
Are you looking forward to that? Tell me a little bit about what that entails.
He's like, deflect to Catherine.
Yeah,
Catherine, tell me your story. From the very beginning, you know.
We can start from the beginning. I'm from Concord, North Carolina, right outside of Charlotte. And my parents are both from North Carolina as well, Charlotte and Concord. And then I went to UNC for undergrad, so Tar Heel born and bred. And I took a couple gap years before med school, so I took 3 gap years. I did 2 as a master's student, so I did a master's of physiology at NC State, which is a really great program. I know the School of Medicine is working a little bit more with them now. And then I worked and applied to med school for a year. And then now I am entering my 4th year, which is crazy. Just finished up, took step 2. That's the board exam they were referring to earlier. Not so fun, not the best part of med school, but now on to the more fun stuff. So I'm also really involved with research. I'm planning to apply into urology. And I'm doing urology research right now and have been since first year. And yeah.
All right. Maybe tell us why urology, what drove you to the field, and if you want to talk a little bit about maybe your research also.
Sure, yeah. So my dad has had a couple of urologic cancers, and he has a really great relationship with his urologist. And I think coming into med school, I always really wanted a specialty. I came in undecided, but I always wanted a specialty where I could have really strong and longitudinal relationships with my patients. That's what I always wanted. I clearly like talking a lot, and so I wanted to talk with my patients, but I also really like procedures, working with my hands. I like a big crafter, and so I thought I would really like surgery, but I was like, you know, those two things don't really go together, surgery and talking with your patients, you know, because your patients are sleeping. So I was like, you know, I don't think those two things will go together. And then, you know, my dad, with his relationship with his urologist, I was like, wow, you know, he's a surgeon, but he has this amazing, like, 8-year relationship with his urologist. And I was like, this is awesome. So I started thinking more about it and just like looking into the field. And I was like, I think I'm a big thrifter. That's like my favorite thing to do, is go to the thrift store and thrift. And my mom always jokes that I have this skill of, I can say, like, I really want a yellow polka dot skirt. And she's like, you can't do that at the thrift store. You just have to go in and see what you find. But then I'll go in and I'll find a yellow polka dot skirt. Like, and she's like, how do you do that? And I feel like I kind of had that with a specialty. Like, I came in, I was like, I really want longitudinal relationships with my patients. I really want to do surgery. I really want like some big surgeries and some small surgeries. And I was like, this doesn't exist. And then I found urology and I was like, it does exist. It's like exactly what I want. So that's kind of what led me to it. And then I've just, you know, I've been doing research with the department for a few years now. My research is in kidney cancer, specifically like small renal masses, and a lot of like decision-making research. So most of my research is like health services research, not like basic science, which sounds like that's what you do. Right?
Well, yeah.
Yeah. We're going to have to get into that in a moment. Yeah. But it's mostly about like decision making and how surgeons and patients both, I do like a little bit of both, how they think and how they make decisions and how communication impacts that. So that's a little bit about my research.
It's amazing. So Jasper, tell us about your science and tell us about where you see it being applied when you leave here.
Absolutely. So it's my research kind of basic science-y. It's a lot of human subjects. I work primarily in stroke. I use a bunch of neuroimaging tools, so MRI, EEG to look at brain activity over time. I also use non-invasive brain stimulation. And the goal is to predict recovery. So there's a value in intervention to prevent injury, but unfortunately it happens. So how can we extend this recovery window and how can we maximize patient outcomes? That's really where my research comes home in. So it's very translational. It's not just we look at this neuron and like it activates and that's it. That goes way over my head anyway. So the goal is to really get patients better. So we work closely with a lot of physicians in our research studies, even on analysis and communicating with them. I think it's all about working as a big team and having an interdisciplinary team between researchers, clinicians, physical therapists, occupational therapists, even the patients themselves. I think getting their voice and understanding that's really important.
Fantastic.
I do want to highlight, if I can, for a moment, that, when we think of the School of Medicine, we do have sort of 3 different educational groups. So there's the medical students, the MD program. We also have the graduate students in the basic sciences, and we have sort of many top 10 basic science departments here in the School of Medicine. And then we also have the Department of Health Sciences, led by Chris Ingersoll, where we have programs that go from undergraduate degrees to master's degrees to PhD degrees. And so it does really speak to, I think, the breadth of what we have in our School of Medicine and sort of the scope of what we do. And then also even just the 2 of you highlighting the different kinds of research that we do, which is, I think, really incredible.
So I'm curious to hear what you would say have been your favorite highlights about UNC so far.
Oh, that's a good question. No, I mean, between when here in undergrad, when we won the national championship, that was amazing. Can't
It's not all about your junior program.
That was fantastic. But I think here, well, honestly, one of the biggest things is I love working with the patients, even though I'm not a clinician or a physician, looking at their outcomes and being able to show that what I see now can potentially lead to where you are. But honestly, a lot of that can't be done without the research. And I was really fortunate to receive some funding from very generous donors like yourselves. And that's been able for me to extend my study window. So rather than looking at one single point in time, being able to look at this over time and really look at the best treatment outcomes. Now, your question, I guess, what was the most exciting part? Getting that reward or award was honestly very exciting. It's the tiny victories, at least in a PhD, because you're very alone, you're doing things very individually. So being able to see a paper get accepted, that's one of the most rewarding things, that someone acknowledges your work, which I'm sure similar experiences for you if you're presenting abstracts. Getting that acknowledgement is so rewarding. So yeah, thank you.
Great. How about you, Catherine?
I think so far my favorite thing at UNC has been the clinical experience. I had such an excellent 3rd year. I was at Central Campus, so if you're not familiar, at UNC, for our 3rd year, we can go to one of 6 campuses: Asheville, Wilmington, Raleigh, Greensboro, Charlotte, and Central. Yeah. So Central is like all at UNC. And so I was lucky enough to stay here. And I just had such a great 3rd year. I think I was pretty sure I wanted to do urology going into 3rd year, but I wanted to go in open-minded. I was interested in OB. I was interested
You can
in
still
OB.
change your mind.
It's not too late.
I'm going to go do a rotation in Urogyne, which is what I do next month. So I'm going to try to see what I can do.
And I did, my psych rotation was excellent. Like just every single rotation I did, even though I wanted to go into surgery, I was like, this is awesome. Like I worked with great residents, great attendings, just learned so much. And I feel like, I wouldn't say I'm like the most like academically like strong student in the world. Like I don't think that's my strength, but I think translating from foundation phase, which is our preclinical years where you learn like all the information before you go on the wards, translating that to 3rd year was like such a rewarding process because you really see like all the hard work you put in pay off 3rd year, and you get to see patients and do what you wanted to do this whole time. So I really think 3rd year was like very affirming for me. This is like awesome. This is what we've always wanted to do. So I think that has been the best part.
Can I jump in? I think we were talking a little bit beforehand because we hadn't had a chance to meet, and that's when I learned she's going to, come to the Urogyne rotation next month. But one of the things that I wanted to sort of maybe touch on is just sort of changes in our MD program curriculum. So we used to be focused on sort of large didactic lectures where students would come to a lecture hall, have a lecture in the front, and have didactics, lecture after lecture. And I think what was interesting, what we found, and she's going to tell you a little bit more about it because this is when she was in, your 1st year and your 2nd year, is that students weren't coming to class. It was not required, but out of a class of 190, maybe 10 to 20 students would show up. And so it was really striking. We've now totally revamped our clinical, or like our sort of that curriculum, which is called the foundation phase, the initial 18 months of the curriculum. And we now also have this beautiful building where the curriculum is held. And the reason that you're in this room, it really facilitates what we do now, which is small group case-based learning. So if you would talk a little bit about, because I think you had a little bit of the case-based learning, but primarily the didactic lectures, sort of the differences between the two and what your thoughts are about that.
Yeah, I am so jealous of the first and second years now who get to do this curriculum. I think it really, number one, facilitates community. Like, I think just being in this building and coming to small group every day for 2 hours a day, case-based learning, which they do in the upper level rooms, and then the PALS is what they call it. Who knows what that stands for? Yeah. Yes. I didn't get to do it. I don't know what it stands for. And yeah, so they get to do PALS, which is in this room. They sit at these tables that you're all sitting at, and they go through cases. And I just think, you know, it really helps you translate what you're learning, like I was saying, but better to your clinical, your clinical learning, because you're doing cases, you're talking about patients, which we did a little bit in our curriculum, but not quite as in depth. Or like as frequently. And then, like I was saying about community, you just see your classmates every day, which we didn't get to do. I was one of the 190 minus 20 who didn't go to class. I watched the lectures virtually from the comfort of my couch. But I think just being able to be here, talk with your classmates. I think for me, one of the most valuable things about my classmates is seeing how they think. I think I really value seeing like how you work through a problem, how you think about this. When you're going through a question, how are you Xing this out? And that's something you don't get if you're not working with your classmates. So yeah, I'm very jealous of the curriculum now. And then the third year curriculum is also different. We had all different lengths of rotations. We were like on a trimester system, which is a bit confusing. I think the residents get confused, the attendings get confused, we get confused. Now they're all 8-week rotations. So before, like OB and Psych were both 5-week rotations, which is not enough time to see all you need to see in OB and see all you need to see in Psych. It's not, yeah. And even 8 weeks is not enough time, but it's better. And they're all standardized and everything. So, yeah.
I do think it speaks to, like, we're always trying to innovate our curriculum and to really figure out what's going to be the best in terms of what you need for learning and to fit in more and more information in the time that we have with you. But really, I do think that's one of the highlights of our curriculum, is really try to be as innovative as possible. I think we got the 5-minute warning already, so we're going to end on a couple more questions, and that's it.
Okay. So hopefully you're all just enjoying being in this amazing space. And one of the things we're so grateful for is that from our donors, multiple pieces of this building are due to our donors. And so much of what you see here is because of the enormous generosity and the importance of philanthropy. So I really want to highlight now and have our students talk about what has philanthropy meant to you in your journey through the School of Medicine.
I can go first, absolutely. Yeah. So I spoke a little bit about it, but it's really been instrumental, as this is like the last part of my dissertation and I need this to graduate, and I had no funding. So I was scared I'd be here for 8 years, which I don't want. My fiance doesn't want. No one wants it. My advisor, she also doesn't want that. So being able to get this funding really allowed me to, A, do my study, extend this window, and then also travel and go to a few conferences. So it's cool that I do the research, but it doesn't really matter unless I don't share it with people. So being able to go to these conferences, network, speak with individuals who are brilliant, way smarter than I, it allows me to kind of tweak my research, make sure it's impactful. Because again, the goal is translation. How do I get this into patients' homes? So without this funding, nothing I do could be possible. So thank you.
Amazing. Yeah, I think that I have a similar experience with that, going to conferences and things, that this scholarship makes that possible. One conference that I went to recently was the AUA, the American Urological Association Advocacy Conference, which was in DC. We spent a day learning about advocacy and what that means as a physician, and how you can advocate for your patients and also yourself. And then we got to go and speak with representatives on Capitol Hill, which was really, really cool. We came with 4 points about what we would want to see and bills and things, and I got to speak with them. And, it's not cheap to go and stay somewhere for 4 days and get there, pay for a hotel. I had to register for the conference, do all these things. And, I don't have unlimited funding to do that, but with a scholarship, it was possible. And then also, there's a fund that all of us scholars can apply for conferences that we either present at or just contribute to. And I was also able to receive $500 to go to this conference. So that's just like one small example, but also bigger conferences and just going and representing UNC is really important to me. I think this university has given me a lot as an undergrad and then also as a medical student. And I think it's the least I can do is go and represent UNC and be a steward of the university and just go represent them well. And I think the scholarship has really made that possible.
It's pretty amazing. I mean, as you're hearing, the scholarships have tremendous impact. And in the short term, they reduce financial stress and then allow our students to engage in things they may not otherwise have done. And it really makes a huge difference on their lives in powerful ways.
Yeah. I mean, in the past, this year I didn't do the talk, but in the past I've also kind of gone and given a talk about sort of the cost of education here at UNC, which again, we've been really intentional about trying to keep our costs as low as possible. And so I think we've done a really good job. We have not increased tuition over the last 5 years. However, the cost of living here is quite a lot. And some people are able to finish in 4 years, but some people do a year of research. And so it takes them 5 years, adding to their debt. And so the scholarships, the donations really make a difference in terms of opportunities for research, attending conference, but also trying to manage the debt that we have of our graduates, which is, each year creeping up, although I will say we are still sort of in the lowest quartile. So we're at like sort of the 22nd percentile when we compare our School of Medicine to other schools across the country. So none of that would be possible without you all. And so just a tremendous thanks from the school, 2 great students. And so again, just really want to thank you all.
Yeah, your inspiration in making donations to our school and supporting our students is a shining light that I think our students then see. So you're always paying it forward. You don't get to pay it back, but you pay it forward to the next generation. So thank you all for serving as that inspiration and investing in the work we do here and investing in incredible students like Catherine and Jasper.
Yeah, thank you so much.
Thank you so much.
Yay!